Welcome, everyone. Connect with the Campaign for Grade Level Reading on social media. On Facebook, like the page Campaign for GLR. On Twitter, follow us at Reading by Third. And on LinkedIn, follow us at Campaign for GLR. Please use the hashtag Learning Tuesdays and tag us to tweet anything you learn from today's webinar, and we'll be sure to retweet. We encourage you to share your questions, reflections, and observations on social media. And once again, welcome to all of you. My name is Sierra Sanchez, and I'll be behind the scenes helping to produce this webinar. I'd like to take a moment before we begin to go ahead and acknowledge our enterprise and programmatic funders, as well as our individual donors. Your support not only allows us to hold these vital conversations, but also helps us to create meaningful opportunities to share insights, foster connections, and build the CGLR community. Thank you. And as we get started, I have just a few housekeeping details to share with you. First, we'd love for you to introduce yourself. So at the bottom of the screen, use the chat box to share your name, city or state, and your organization. Be sure when responding to select everyone so that we all know who is here. And feel free to share your thoughts and insights throughout the duration of the webinar in the chat box. All attendees are in listen-only mode, but we encourage your engagement by posting questions in the Q&A box. We will dedicate the last portion of the conversation to respond to the questions you post. This webinar is being recorded and live streamed on Facebook, and a link to the recording will be emailed on Friday to all who registered. In that email, you'll also be able to access all resources, slides, and bios from the conversation. And finally, we'll be posting a brief on-screen evaluation during Q&A and highly encourage you to respond. This helps us with our commitment to continuous improvement. And before we begin, I'd like to call your attention to our upcoming webinars. Over the next 2 weeks, since many of us will be enjoying the holiday break, we plan to host 2 rebroadcasts of some of our most interesting and engaging discussions. Next week on December 24th, join us to review our recent session focused on strategies to support school attendance in the post-pandemic time. The following week, on December 31st, tune in for a session focused on family engagement as a highly necessary strategy for learning acceleration. Both of these sessions will be on our YouTube channel, and you'll see them as special holiday rebroadcasts on our channel. So we encourage you to take a look, and registration for those will be posted in the chat. Then in the new year, as we launch 2025, we look forward to an extremely robust discussion of the post-election era of sustaining academic recovery on January 7th. And on the 14th, we'll have a chance to discuss an issue that is at the forefront of all of our minds in early school success, the science of reading and how to ensure equity in early literacy instruction. Again, all of these registration links will be posted in the chat box now, and we hope that you can join us. And joining you now is Emily Samos, Senior Consultant with the Campaign for Grade Level Reading. Thank you and enjoy the webinar.
Thank you, Sierra, and welcome to all of you, and thank you so much for joining our special session today titled Childcare Has Shifted. Are we ready for the future? ? Many of you joined our series on childcare in October and November with Dan Wuori, the author of the Daycare Myth, What We Get Wrong About Early Care and Education and What We Should Do About It, along with Ellen Galinsky, who's of the Family and Work Institute, along with many other experts. We first had the opportunity to explore the book's assertion that the United States is long overdue for policy change to address issues resulting in inaccessible and unaffordable infant and toddler care. And then in November, we reviewed state policies that are addressing the 3-legged stool of early care issues, which is affordability, quality, and workforce development / retention. These discussions, along with many other current national conversations and news reports, have drawn major attention to the ways in which the field of early care and education is experiencing a period of significant shift. Changes to the labor market, increased understanding of the science of early learning and early childhood, and the visibility of the childcare crisis present an opportunity to really interrogate and reimagine childcare. And today we have the excellent opportunity to do just that. We are going to interrogate and explore how we can reimagine childcare. In a way, today will be part 3 of CGLR's ongoing examination of childcare policy and practice and its future. We will hear from childcare experts and advocates about what it will take to reimagine how we define childcare, who childcare serves, who funds and regulates childcare. We also have the chance to learn from local early childhood educators and administrators, along with policy experts representing diverse settings and childcare options, who will share their perspectives on how childcare can better meet the needs of young children and their families from their experience on the front lines of this important work. I also want to mention that we also plan to host a fourth session. It will be in February, and we are going to focus that fourth session on the increased impact of profit-driven backing for childcare companies and organizations. So please keep your eye out. You know you'll get the emails. You'll get the notifications. Again, that will be scheduled for sometime in February. And so we are super lucky today to have a nationally recognized early childhood and human services leader, Susan Gale Perry, who is Chief Executive Officer of Childcare Aware America, as our moderator, and she's going to facilitate a great conversation. And now I'm honored to welcome and really briefly introduce our esteemed panelists with us today in alphabetical order. And please note we've already posted full bios in the link in the chat. I will post them again, so I'm just going to quickly run down who we have with us today. We have Rhian Evans Allvin. She is the founder and chief executive officer of Bryn Mawr Early Education and Preschool in Virginia, and was previously CEO at the National Association for the Education of Young Children, or NACY as it's known. Jamal Berry serves as the president and CEO of Educare DC. His journey with the organization began in 2013 as an infant and toddler master teacher, following his role as a Head Start and pre-K teacher in Washington, D.C. Kayla Corbitt is a leading expert in military childcare with over a decade of experience supporting military and veteran families. She's the founder and CEO of Operation Childcare Project, which we'll learn a lot more about today. We also have Tiffany Jones. She is Chief Executive Officer and Family Childcare Educator at Precious Moments Family Childcare in Maryland, and she's a sought-after early childhood educator and mentor to fellow family childcare providers and parents alike. And lastly, we have the awesome Marica Cox Mitchell. She serves as Vice President of Early Childhood at the Bainum Family Foundation. And she's an early childhood expert and leads the foundation's early childhood programmatic strategy, driving futuristic solutions. And she was really a big help in pulling this session together. So we are very grateful to her and want to say welcome to all of our awesome speakers. We look forward to engaging with you and learning from you. And now I'm excited to turn it over to Susan to get the conversation going.
Thanks, Emily, and hello, everyone. I know all of you are on mute right now, but I invite you to think about this as a conversation. We're really looking forward to learning from you and hearing from you when we dig into the question and answer session. And I just want to start by saying that at Childcare Aware of America, we often say that America has a broken and inequitable childcare system that's holding everyone back. But it doesn't have to be that way, because we believe that when childcare is strong, everyone is stronger. So what is exciting to me about today's conversation is that we're going to stop focusing on admiring the problem, which we all know so well. There are so many problems with our current childcare system. And we're really going to focus in on what is possible. What if we thought about it in a whole different way? What's working? And where might we want to take it next? And I am so excited to kick off this conversation with some thought leadership from Marica Cox Mitchell from the Bainum Family Foundation. So Marica, I'm going to turn it over to you in just a second, and I'd love for you to share your perspective on what's happening right now in the field of childcare. What do you think are the significant shifts that we should be thinking about? And talk a little bit about WeVision that you all have been talking about as the Bainum Family Foundation and how you're reimagining childcare.
It's great to be in this conversation. And I agree, Susan, shifting away from how broken the childcare system is and looking at the future. The Bainum Family Foundation, I'm here representing our 70 plus partners, supporting early childhood research policy and practice across 18 states. And these partnerships and our partners, we call them our proximity experts because of their proximity to young children, really drive our investments and portfolio. And when they speak, we listen. Over the years, they've told us that they appreciate the resources we provide to help them navigate the system, but are hoping that we can do more, given our privileged role in the childcare ecosystem. They're hoping we could do more reimagining and shifting the conditions that are holding their current pain points in place, which is why we lean into systems change to address the childcare crisis. And next slide, please. For systems thinkers, they have many habits. One of the most important habits of a systems thinker is to be excellent observers. We must see how the elements within a system change over time. And certainly we've seen that childcare has shifted and there are new patterns we have to pay attention to. This is a unique moment in time that we need to pause and celebrate. We've seen increased public funding, increased media coverage, increase in private funding, and an expanded advocacy base. And as one of our proximity expert told us in a recent conversation, he was like, Marica, I do not want to be a victim of the future of childcare. I want to shape it. And so as systems thinkers, we need to pay attention to the signs, see the ways the system has shifted, and actually shape the future instead of being victims to it. And to highlight a few of the ways in which childcare has shifted, I'll use sort of the intersectional accessibility, quality, affordability frame to, again, elevate ways in which we need to re-examine the childcare system. We'll first start with accessibility. We're now shifting to a childcare system where most families are needing childcare support and are asking for childcare support. We're also shifting away from just handing families and practitioners as well, sort of confusing and limited options where we're using acronyms and giving them 5 different funding streams, using different nomenclature to name the childcare options that perhaps make sense to us who are working on the inside, but is extremely confusing and feels limited to families and practitioners, into a system where families and practitioners have very clear and funded options. Same with quality. We're shifting away from having overwhelming and varying quality standards and regulations into a system where we have more streamlined and unifying quality standards and regulations. And certainly in some contexts, you're hearing the deregulation language used. This is an opportunity to either right-size regulations and streamline regulations, or we're going to have to lean in and make in some ways, we are making the case for deregulation when we are holding on to the status quo. Families and practitioners are saying this is overwhelming, make it make sense, fix it, or frankly, let the deregulators fix it for you, is how I see this issue right now. And early childhood competence, early childhood educator competence and compensation are not unfunded, kind of nice to have. We'll build an entire QRS system or entire childcare system. And yeah, it'll be nice if in the end we could get to compensation. We're now shifting to a childcare system where educator competence and compensation are seen as funded necessities and not nice to have. And then quality, as far as affordability, for affordability, we're shifting to a system where few families are not only receiving childcare support, where more families are receiving childcare supports, where families are not the only ones carrying the cost of childcare, that government, taxpayers, and businesses are also paying the most for childcare, and a model that's not refunding based on current tuition, but a model that refunds towards using true cost of providing early childhood. So these are shifts in quality, affordability, and accessibility. Next slide, please. So WeVision EarlyEd, we, again, listening to our proximity experts, have been leaning in to make sure we're defining the ideal and making the ideal real. And that definition, like the proximity expert stated, has to be early childhood educators and families, not being victims of the future or not being afraid of the future, but leaning into it and shaping it. It's going to require us to change. Change is going to be required as we lean into these shifts that are happening. Next slide, please. Change is going to be required and change is hard. We cannot hold on to our current mindsets and at the same time make room for systems thinking and shift the system. We're all going to have to change to lean in. And so WeVision EarlyEd elevates the core mindset shifts that we as a collective are going to have to make as we gear up for this inevitable future. Rethink when learning begins and not splintering the early childhood education system with sort of 3 and 5s being one space and infants and toddlers, not thinking that education begins when young children start public schools, which is typically at kindergarten level. We need to rethink who needs childcare. Childcare is no longer an intervention for a very small subset of the population. It is now for, should be for all families, what it costs, how to pay for it. We need to certainly rethink quality and governance and decision-making. And as bell hooks, who is one of my favorite futurists, often tell us that if we cannot imagine it, it's not going to come into being. What we cannot imagine cannot come into being. And again, this is the WeVision EarlyEd space. It's a space for us to imagine based on data from families and early childhood practitioners so that it can come into being. So again, in the WeVision EarlyEd space, where we're reimagining childcare and leaning into those inevitable shifts that are happening, families are going to have clear and funded options. Early childhood education program, which can happen in multiple building types. It can be home-based, center-based, or school-based. Here, we're separating what's happening in the space from the building types. We're decoupling that. We're also decoupling early childhood education from funding streams. So regardless of funding streams, you have early childhood education programs in all types of buildings accessible to families, as well as having a category called trusted caregiver. And those are family members, stay-at-home parents, nannies, au pairs, community members who are like, I know I may have an amazing slot in this affordable childcare future for my child, but for multiple reasons, I prefer to do it myself. I prefer a nanny. I prefer a stay-at-home parent. I prefer my amazing grandmother. That's our family's business. We have some cultural values that allows us to sort of make that preference. Of our working conditions are a little bit different. We're doing the gig economy, so we don't have sort of just traditional 9 to 5 hours. We want this trusted caregiver category. All early child education programs must meet the baseline quality standards for early childhood education and all receive comparable funding. So again, the funding does not vary because of the building type. They're all getting comparable funding and held to meeting a baseline quality standards for early childhood education. Trusted caregivers are asking for autonomy. So trusted caregivers have the full autonomy. They're not regulated as part of the early childhood education field. They're not early childhood educators. They have their own identity. And that identity comes with a greater degree of autonomy and a different way of funding them. The families are essentially their own regulators. And it's happening right now. There are many families who took care of their young children who aren't regulated as early childhood educators. They just tend to be on a more affluent side. And so we don't see them as trusted caregiver. And then, of course, unpacking quality. So again, thinking only about the early childhood education program, this does not apply to trusted caregiver, normalizing in the field a bit with a baseline set of quality standards where the states and federal government are responsible for creating standards that govern the safety of the building, so the facility safety standards. I think we sometimes think that childcare regulations and childcare licensing are about the individual practice of the early childhood quality when that was never the intent for that. It's actually about the facility safety. So having states and federal governments define facility safety standards, having the professional associations name and define the industry recognized early childhood program quality standards, and then making sure there's government funding, state, federal, and local, to ensure there's a baseline funding to cover the true costs of programs meeting those facility safety and industry recognized standards. And certainly adding additional specialized standards and funding on top of that. But we have to make the baseline make sense. Next slide, please. And so the future is already happening. It's what the futurists will say. And again, with WeVision EarlyEd, we're trying to make the future happen right now as we speak. Next. Which is why we are funding programs in this way. We have solutions lab sites across the country. We have the early childhood option, and these are the 5 deliverables we hold them accountable for. It's a lot of accountability and autonomy. They're meeting the industry recognized quality standards. They choose it. We're learning. Let them figure it out. That's part of respecting early childhood educators as professionals. You give them professional autonomy. They're documenting child growth and development. They're defining the annual cost of quality and certainly compensating early childhood educators at using public school wages as a guide, intentionally supporting their well-being and making sure that it's affordable for all families, including those who are not eligible for subsidy. And we're also supporting the trusted caregiver option, again, demonstrating that these 2 options are distinct, but they can coexist and be funded and held accountable in different ways. With the trusted caregiver options, we have partners who are family support organizations. They're providing some financial support for families that prefer this option. They're, again, supporting families who may not be eligible for subsidies. And they're using data from families to offer but not mandate additional resources. So for these families using the trusted caregiver option, while we're providing multiple resources for them, we're not mandating that you have to go to this training to get access to financial support for the families. I know it was a lot. You can follow us on WeVisionEarlyEd.org to have more conversations about this. But I know, Susan, I imagine you have a gazillion questions.
Yes, Marica, I do. And thank you for sharing that overview. And I really want to dig in with you on a few of the concepts you just proposed, because we all may be nodding our heads, but there's some pretty radical ideas in there, Marica, that are very different from the current system that we have. So I want to start by prompting you a little bit more. You showed that intersecting diagram of quality, accessibility, and affordability. So can you talk a little bit more, and you sort of laid this out, about who should define quality, who you think should define quality, and how you think programs should be regulated, as opposed to who's setting standards for the workforce, and why you've broken those out. So at a baseline, how you even think about defining quality, and then, who sets the standards.
Yeah, I often say simplicity is going to be the early childhood innovation, which, right, as a funder, when we fund dental screenings for young children, we do not define best practices in dental care. You know why? Because we trust the autonomy of the American Dental Association and the dentists to figure that part out. We trust the licensing board for dentists. We're like, y'all figure out that part. We're going to stay in our lane. We do not have the expertise in dental care to even sort of regulate and say anything about your practice. We can inquire, but we do not hold space. Frankly, we're not even invited to their tables when they're having conversations about fluoride, just because we're a funder, for good reasons again. And so we just took a similar approach and said, okay, if this is early childhood education, this is a recognized profession, and our proximity experts underscore that they need to be treated as professionals, we do the exact same treatment and say, hey, as a respected set of professionals with autonomy, where do you turn to? Where is your industry recognized quality center that we can leverage and lean on in this shared governance model? Doesn't mean that others can weigh in, but we have to give space for the early childhood profession, like we give space to the American Nursing Association when we're writing regulations and policies, like we give space to the American Institute of Architects, right? I can go on and on and on. It happens in every other sector, frankly, except this sector, where we do not give sufficient space and leverage the industry recognized standards and systems. Instead, we duplicate them and then wonder why we can't find funding for compensation.
Okay, so I want to make sure I'm understanding that. So you're positing the idea that let the early childhood educators themselves define their own standards of practice and monitor their own standards of practice, that it is their industry, that they should be the experts because they are the experts, and they should have their own structure for creating and assuring their standards. Is that kind of what you're saying?
Correct. Yes, every profession, right, to be a profession, right, in the sort of the purest definition, you organize yourselves and have your national set of standards guiding your work.
Cool.
It's not pretty. It's sort of messy behind the scenes, but as funders, as policymakers, as lawmakers, we leverage what the professional provides and not duplicate it. So this is an opportunity. Again, we all have to change. Part of the change is early childhood educators sort of standing up, frankly, and saying, as an early childhood educator, X organization, X entity holds the industry recognized quality standards. Because in the absence of that, then you're allowing states and lawmakers and government agencies to sort of weigh in and define it for you. So in this moment of increased visibility, it's either you define it yourself or it gets defined for you. Those are the only two options.
Okay. And we'll circle back on defining quality childcare more broadly beyond the workforce, but before we'll bring the panelists into that. So let's talk a little bit more about cost. You have a slide where you've sort of lined out, we're paying what's, we're looking at what people are charging to saying we're actually paying based on the true cost of care. How do you think we should define what the true cost of quality is, and who should define it?
Yeah, which is why it's important of building the baseline, right? Like, what is early childhood education? What are those industry recognized standards? What are those regulatory standards to ensure that the buildings are safe? Like, once we define that, then we turn again to early childhood administrators, as sort of will be my go-to, and say, given that you have to meet these expectations of practice, what is the true cost? What is the per pupil formula? And frankly, in our work, we found that that's simple question around sort of what is your per pupil formula was perhaps the hardest for the lab sites we're working with. And so we made that a deliverable. Let them tell us what the true cost of quality is, because for so long, given that we're all in sort of survival mode of the childcare system, they're so used to saying, well, I need my summer camp kids to offset the cost of an infant slot. We're like, don't do that. Give me the true cost. Or I wish I could pay my educators more, but I can't. So therefore, I'm using this set of salary scale. We're like, don't do that. Here's an opportunity to define the ideal. So I will say early childhood educators and the administrators, they get to figure that out, but we have to be clear about what are the services we're paying for. And in our case, through WeVision EarlyEd, we're holding them accountable for meeting their industry recognized baseline quality standard and giving that. Let's figure out how much it costs per child.
Okay. That is exciting, and will be exciting to see how that all plays out. So the last question for you before we bring in the panelists, Marica, is there's one really important sort of gating question about who is the early childhood workforce? Who are early childhood education providers or childcare providers, I guess I should say. So you talk about differentiating between trusted caregivers and early childhood educators. And it seems like our field has been very ambivalent about everyone's a child care teacher, children learn in all environments. These things are true. But I think you're trying to make a distinction for a particular reason. So can you talk more about the distinction you're making and why you think that's important as we reimagine a child care system?
Yeah, I think it's for, again, giving families clearer options, right? It's for giving practitioners as well sort of clear options between like, what is the scope of their practice, right? And recognizing early childhood educator as a a profession that has specialized skills and expectations, right? Like if we keep having this amorphous workforce identity or this archaic notion that everyone who touches the life of a young child is automatically an early childhood educator, while again, yes, that may be true that adults that care for young children all have an impact. That's absolutely true. But mushing everyone together and automatically just sort of handing out early childhood educator identity to anyone who touches the life of a young child makes it very ambiguous to hold early childhood accountable for their practice, particularly as we see increased public funding coming to the table. As well as it also weakens the case for compensation, right? I mean, if everyone who touches the life of a young child is an early childhood educator, then I don't understand why am I paying you comparable to K-12 wages? Why do you want K-12 benefits, right? Then let everyone, including the 16-year-old who's TB free, that's an early childhood educator. So we have to be really clear about the identity of early childhood educators and also recognize that there are other trusted caregivers who have an important role in their community who can totally support the caregiving needs of young children that can choose to not exist as early childhood educators. And given our history of racism and sexism, that distinction has to be really clear, or else, anyway, that decision has to be clear, or else it's going to, again, reduce our case for compensation, professional autonomy. And so, yeah, so trusted caregiver definitely have a role. It is distinct from an early childhood educator because the accountability for practice is also distinct.
I love that, Marica. And I think that in your reimagined childcare system, those trusted caregivers is, in your view, is an absolutely okay choice for families to make. And as long as they have clarity about what that means in terms of who's governing, who's overseeing that, and that they may need support in paying for that. Is that part of your model too? That trusted caregivers are a part of the continuum of the way children are cared for, and there's just a different set of expectations that families should have for both.
Absolutely. It's a bona fide childcare choice. It is just distinct from an early childhood educator or early childhood program. And as such, again, the accountability looks different. The payment mechanisms may look different, but that doesn't mean they're not a valid and bona fide option. We just have to figure out how they can both coexist instead of, again, we continue to mush them together or create a false hierarchy. And that's an outdated model.
Love that. Okay, it feels like I'm seeing a lot of yeses in the chat, so I'm sure we're going to get some great questions. It feels like now's a good time to bring in the panelists and engage in some reactions from the broader group of panelists. Wonderful. Hi, everybody. Great to see your faces. I'm going to, first of all, thank you, Marica, for being willing to be put on the spot and sharing your model and vision and putting it out there because, you know, I love that quote about like, if we can't reimagine it's not going to happen. And so you've created a reimagined system for us all to react to. So I want to, again, thank this amazing group of panelists. They're all, I think, creators in their own right and creating new ways of thinking about our early care and education space. So want to hear a little bit more from each of them and ask you some questions that dive a little deeper into what Marica has already shared. So let's start with a question that I can kind of pose. I'll start with you, Rhian, but we can get reactions from everyone about who the childcare workforce is. You're now an owner and an operator of a program. As a field, as I mentioned earlier, we've really struggled with not leaving anybody out. Everybody's care is equally valuable. You've heard Marica talk about why she thinks it's important to make that differentiation. So what do you think about that? And how do you think this can contribute to moving the vision forward for a new vision for childcare?
Well, good afternoon, Susan. It's great to be with you and with the panelists. And I'm Rhian Allvin. And let me give you a little bit of context about what I'm doing, so it might help a little bit with framing my perspective. I have spent my career in policy and advocacy in early childhood and have moved into the operations side of early childhood education with Bryn Mawr early care and early education and preschool. We have 2 centers, one in Lorton, Virginia, and one at the Department of State in Washington. And we really exist for 3 reasons. I'm just frustrated with the lack of progress that we've made in early childhood education, given 25 years of neuroscience that says this is the most important time in human development. And so knowing that, I wanted to try to capitalize on what we know with the neuroscience and what we know about, to Marica's presentation about the workforce. So our North Star is 3 very definitive things. One, that we're committed to a floor of everyday quality. And for us, that is NACCE accreditation. So we are working, one of our centers is accredited and the other one is working itself through the NACCE accreditation process. The second is that we're serving children from all socioeconomic levels in one setting and trying to discern what happens as a result of that or what the benefits are. So we have full fee paying children. We have many children who are subsidized through the Department of Defense. We have children who are on a scholarship, whose total household income falls between $69,000 a year and $120,000 a year. And we have children who qualify for subsidy. And our third North Star, into Susan's question, is around the workforce. After our field spent 3 very definitive years defining what early childhood educators should know and be able to do through the unifying framework, I thought, what if you put that to practice? And so we hire based on the ECE 1, 2, and 3 levels in the unifying framework. We benchmark all of our salaries and benefits to the public school system that is in our jurisdiction. We work 4 10-hour days, our educators do. And we have a really robust compensation or benefits package for them with health insurance and long and short-term disability and retirement. We match a retirement contribution. And we also have life insurance. So that is our constellation. And I think, Susan, to answer your question, I really appreciate Marica's definitive framing because we have kind of convoluted everything together. And I think at the core of what we do, whether it's from a practice or a policy perspective, parent choice should be a floor. And parents have to have robust options, and they don't right now. We kid ourselves that parents have options. They get pigeonholed into options depending upon what their income is or what geography they're in or who their employer is or how old their child is. And so starting with parent choice, we have to honor that in the policy decisions we make, in the practice decisions we make. And so saying a parent may want a nanny, a parent may want to stay home, a parent may want the neighbor, a parent may want to go to Bryn Mawr, that all makes sense. We have an obligation, though, to create a structure around that we're just not conflating it all. And I think it's possible. I think the unifying framework does a brilliant job of defining the field and then what the profession looks like inside the field. But it's absolutely doable. And we can both include everybody and be specific about what we mean when we name different elements of people who are in the field.
Awesome. Before I see if anybody else has a burning thing they want to contribute to this particular question before we move on, Rhian, you mentioned the unifying framework, and just for the benefit of the audience, would you mind giving the 30-second, 15-second, what is that?
Sure. Yeah. In 2015, the National Academies, they had released Neurons to Neighborhoods at the turn of the century. And then in 2015, they did a follow-up report about transforming the workforce. And 700 pages later, it basically says that the neuroscience matters to get the kind of outcomes we all hang our hats on in early childhood education, the economic outcomes, the benefits to society, the benefits to young children, and that early childhood educators have to have a defined and distinct pedagogical knowledge in order to capitalize on that. The complexity of math and science combined with reading and language and even neurodiversity and cognitive and social emotional skills that you can't just, I'm not an early childhood educator. I could not walk off the street and do that in a way that someone who has the pedagogical knowledge and background can. And so the profession reacted to that with the unifying framework for the early childhood education profession. It was a 3-year it felt like a Quaker meeting a little bit, where we had 13 organizations come to the table, from the unions to family childcare to 0 to 3 to Childcare Aware and NACI, and really hashed out, do we all agree what this profession looks like? There were 500 focus groups around the country. There were thousands of people responding to surveys, and the result was a unifying framework for the early childhood education, which now has resulted in model legislation that I would love to see. Vermont is working on it right now, and I would love to see other states passing it as well too.
Thanks, Rhian. And I see
Yep.
Emily has put that resource into the chat for those who are interested. I'm going to move us to the next question, but feel free, folks, to jump in any point if you have a burning thought that you want to share. But Jamal, I want to move to you and move to a question about affordability right now. Marica talked a little bit about how we should think about how much it really costs to provide quality childcare and who should pay for it. I'd love to hear your thoughts on that. How much does it really cost, and who do you think should pay for it, and your experience and the kind of work that you're doing? And are there expenses you think that we just aren't thinking about that we should be thinking about?
Well, thank you for that question, Susan, and hello to everybody out there. Like Rhian did, I want to give you a little bit of context about who I am and what I may bring to this work. And so I was a pre-K teacher for 6 years before joining Educare Washington, D.C., and then worked with infant and toddler teachers. We have a role called a mentor teacher where you supervise and support them, and then school director. And so I've been in early childhood education for almost going on 20 years now. Currently, in my role as president and CEO, I oversee an organization that serves over 400 kids in wards 7 and 8 of Washington, D.C., as well as we have 80 teachers and over 140 employees. I also sit on numerous advocacy boards, and then I'm the co-convener of DC Men in ECE, where we're trying to recruit, retain, and also grow 100 Men of Color. So a lot of work with teachers and educators on professional development. So to your question, Susan, I think that there's a couple of things missing when people think about their cost. One of the things would be research. So at Educare Washington, D.C., and also in the network, every educator has a local evaluation partner. I think it is an important component to our work as we look at data on children, we look at data on classroom quality, we look at data on teacher questionnaires, and we use that data for continuous quality improvement. I think what that allows us to do is fail fast at things, right? And to be able to have a research to support us in this new practice or intervention, and if it's working for children, and really get to the bottom of it. So I've done innovative things to look at teacher tenure and qualifications to outcomes for children in that classroom to see if we can see patterns and trends. So I think a research component to every program is something that's important that doesn't necessarily show up in budgets a lot of times. I also think leadership and management systems don't always show up. I think the name of the game is to do more with less oftentimes. And so we minimize how much management and systems need to be in place to run an organization. And then Marica, I think, put it beautifully in hers when we think about staff wellness. So a couple things that we do, we have a staff wellness manager. So I think staff wellness support budgeted for as a proactive measure and not reactive when events happen is important, as well as professional development personnel that are geared in adult learning principles, right? So they understand how adults learn and are actually creating content and trainings around that. And then last but not least, I think just innovation and strategic opportunities. So budgeting for innovation. budgeting to do innovative stuff with staff, budgeting to support staff in ways that they want to be supported is also important as well.
Thanks, Jamal. I love that you brought into the conversation, our need to think more broadly about how we're supporting childcare beyond just the teacher in the classroom, that there is a lot of other folks making it happen, whether it's the administrator or people, if it's a center-based program that offers food, people doing the food preparation, and you also brought in the wellness of the staff beyond their compensation and how you're caring for those as we think about cost. I really appreciate that. And the research and how we're actually looking at the outcomes that we're trying to achieve and how are we doing on it. Really, really additional factors that we would want to think when we're thinking about the true cost of quality. So now I want to move back to the conversation, not to leave them out, of trusted caregivers. And Kayla, I'm going to turn to you, and I know you'll talk a little bit about who you are and the work that you do, working particularly with military families who often have caregiving needs outside of the 7 a.m. to 5 p.m. or 6 p.m. time, and are often struggling with relocations regularly. So talk a little bit more about particularly trusted caregivers when it comes to supporting military families and how some of your work is unfolding.
Thank you. Yes. So I do predominantly, my work does focus very heavily on the military veteran community, but I think it's important to note that you cannot examine that area without acknowledging that less than 15% of military families are accessing care on installations. So that means that the vast majority of them are in your community. So when we talk about solutions for families and we isolate military families from that, we are really missing a huge piece here. There are families that we end up losing in the process. They are using the same programs that you are. What I'm here to focus on really is that trusted caregiver model, and I really want to explore it a little bit more. There was a question I'm going to answer here in a second that came in. I use the term trusted caregiver because there are a lot of titles, and we've already seen it in the chat, some of the comments here, where if I say nanny, if I say stay-at-home mom, if I say neighbor, they all have these connotations to them. They are given these rankings in your head of what quality could be. And it's vital as we discuss this and explore the trusted caregivers that we start with a very neutral lens, regardless of their relation to a child. And one of the questions that we have in the Q&A that I did want to answer, because it kind of fits in with my response to you here, is in reference to whether trusted caregiver is always a choice. So is this always something that someone has chosen to do? And I think, especially in terms of military and veteran families, but they are not unique in this, we need to also look at people who do not have a choice, people who do not have alternative options. We see there's a state scan of FFN, so the family, friends, and neighbors is another term that we hear in reference to a trusted caregiver. And when in the state scan, what they really examined is that the current policy strategies are trending towards center-based care, which inadvertently ends up challenging what quality care access looks like for children in 4 major categories. And I'm going to tell you those categories, and I think you can see where the overlap could be between the civilian and the military world. And that is families who need non-traditional or variable hours. So their hours are changing from day to day. Those who need infant or toddler care, young families, children in rural areas, and children with disabilities. So these are our 4 at-risk demographics that we're most likely to see utilize a trusted caregiver model. This model of trusted caregivers, parental and non, we'll start with non. Even non is the most prevalent type of non-parental care that is offered in this country. It is a friends, family, neighbor, trusted caregiver. Second to that, the largest type, over half of children, according to the 2022 census, between the ages, I think, 5 and 11. So I did not memorize the statistic for under 5, but over half of them aren't using any care. So what does that mean? It's probably a parent. So they didn't delineate themselves as needing a paid trusted caregiver. They delineated themselves as needing no care, meaning that they were probably offering that themselves. And I think as a country, we've really struggled to see the value in quality care unless it is being provided in a center-based or an educational setting. And what has happened is we're really leaving these families and their voices out of a conversation, and it's eliminating nearly 3/4 of the population. So as we start examining more, what is a trusted caregiver model? What does it look like? I think that these are important things to keep in mind, is that it's not far away, it's right here. It is today, is what is happening. And to not acknowledge that would really be leaving most of this conversation. I think it would hinder us moving forward in this conversation of reimagining.
I think you brought up some really important points about what really are options, and are people really having choice, and are they given clear choices, which I think goes back to the whole vision of WeVision, which is to try to drive clarity of option and choice. And I'm sure that we'll have a little bit more time to talk about that in the Q&A as well. I definitely, though, want to give a moment to bring Tiffany into the conversation, because Tiffany, you are a national leader in the family childcare space, but we know also that family childcare has been going through significant shifts. And I'd love to hear from your perspective what you're seeing when it comes to family childcare, as being seen in an ongoing way as really a viable and funded childcare option. We know nationally that we've seen a significant and ongoing decline in the number of family childcare programs, and I'd love to dig more into that and get your perspective on, where does family childcare fit into the system, and what do we need to do to better support it?
Thank you, Susan. And like my colleagues before, I just want to give you a little bit more context of who I am. I'm Tiffany Jones. I'm a family child care educator in Maryland. I also provide state-funded pre-K through a partner, Family Child Care Alliance of Maryland, their Aspire program that supports family child care educators all over the state of Maryland in providing state-funded pre-K. I am also a policy fellow in the Maryland State Rep for the National Association of Family Child Care, and I am the president of our County Child Care Association in Montgomery County, Maryland. So I represent our family child care educators all over our county, but also the family child care educators all over the state of Maryland, nationally to NAFCC. So like you mentioned, the landscape of childcare is undergoing significant shifts. I think society is realizing that, especially during the pandemic, when a lot of childcare centers were closing, family childcare educators still had their doors open and were providing care to emergency professionals and families that needed to get to work. They were not able to work remotely. So we saw that family educators were, working hand in hand with families, even during a very tenuous period in, I guess, all of our lives. But we've seen that it's been recognized more and more as a viable and sustainable and definitely essential option for childcare. So Marica mentioned that in recent years, the recognition of family childcare just keeps getting bigger and bigger. And funders and our local government and our federal government, understanding that we play a vital role in the childcare ecosystem, that kids don't just arrive at kindergarten, they were somewhere before, whether that's a childcare center or a family childcare program like me, or like Kayla mentioned, a trusted caregiver. So I think also in our field, there's an increasing push to professionalize what we're doing. I think also, like Marica mentioned, having some consistency in how we're funded and it not being dependent on our the type of building that we're in is a really important thing to recognize, that the early childhood education that I'm providing is equally as high quality as that of one that could be in a public school setting. As she also mentioned, there are a lot of authority bodies, that we have to be accountable to. So defining us by our building type really is an antiquated way to look at us.
Thanks, Tiffany. Okay, now I'm going to ask all of you to respond to this question. Part of what Marica put out on the table, and that is getting a lot of attention lately, for good or for bad, however you might think about it, is around regulations. So we know that there are many efforts across the country now to change current regulatory requirements. And, in the system we have currently, not in Marica's reimagined system, our current regulations cover everything from building facilities, health and safety, to things like ratios, group sizes, and workforce standards, typically. My question to you is, each of you, is do you think that there's room for regulatory reform within licensed childcare settings while still holding on to health, safety, learning, and nurturing? We've seen some papers come out about deregulatory efforts that were not so positive. So I'd love, from those of you, particularly, you're all operating programs, particularly I think from you, Tiffany, Jamal, and Rhian. I'd like to start with the three of you. Do you think regulatory reform is desirable and possible while still maintaining things that are really important to keep children healthy, safe, and learning and nurtured? And Rhian, let me start with you, and then I'll move to Tiffany and Jamal and see if Kayla and Marica want to weigh in.
Thanks, Susan. Yeah, I definitely, this is obviously a hot topic right now. It's been a hot topic since the beginning of time, I think, and at least, for decades now, and for good reason. We don't want children to be harmed, and the public, vis-a-vis the government, has a responsibility for children to not be harmed, to protect the public, to protect the health of children. But I actually think, to Tiffany's point, there's a reason we've been defining early childhood education by the building, and that is because we only regulate by the building. We regulate based on the definition of the building and who you are from a operator perspective. And I would argue that we're completely missing the boat by having these wild back and forths on whether we regulate more or deregulate, regulate less. I would say we're regulating for the minutia. And we're regulating for the minutia because the entire regulatory structure is around the provider and doesn't account for the licensure of professionals within the system, which is really important. And I'll give you an example of that. Let me say very clearly, I'm not pandering. I am very fortunate to be in Virginia and DC with regulators who are very sympathetic, who are good partners, and we're dealing with the regulation that's in statute. And I had a ding on an inspection. A early childhood educator with a bachelor's degree in early childhood education had just completed an activity with toddlers, and there was shaving cream that was left out on the table, and we got a ding. We got a citing for the shaving cream that was not closed and locked. And I use that as an example because we don't trust the people in the setting, because we're unwilling to say there's a differentiation between somebody who is 16 and free of tuberculosis, and someone who has a bachelor's degree in early childhood education, we regulate for the minutia. I will give you another example of this. I did a side-by-side comparison of the childcare regulations in Virginia to hospital regulations. Now, arguably, hospitals, life and death, right? People are dying in hospitals, they're living and they're being saved in hospitals. Childcare licensing and hospital licensing are almost the exact number of pages in Virginia. Hospitals a little bit more, but the nature of the licensing is wildly different. And I think it's really instructive to us. Whereas, to what you mentioned, ratios, group size, all the details that did the child have their physical a month before they started the program or 2 months before they started the program? Whereas hospitals are, what's your governance structure? What is your fiscal accountability and responsibility? Do you have licensed practitioners in the hospital? Are you accredited by the hospital accreditors? Like they trust hospital systems to handle the minutia because there are licensed people and industry standards that the industry is guiding. So I am going to say, regulation has to exist in early childhood education, but because we've chosen the path that we have, the government has played an outsized role in regulating buildings and programs, and therefore we are in this boat where we're literally spending hundreds of hours a year looking at the paperwork we're doing to making sure that we're in compliance.
So that to me is a plug for yes to regulatory reform, but and yes to more clarity on professional standards for the educators themselves so that you don't have to regulate every minutia because you trust them as professionals to do the work. Yeah.
Totally. Exactly.
Okay. All right. Jamal or Tiffany, who else wants to weigh in on this?
I would just like to add that I agree with what Rhian is saying. As a family child care educator, I'm wearing like 1,000 different hats. I'm not only a teacher, I'm a chef, I'm the janitor, I'm the accountant, and I'm doing all of these different things. I'm, managing the different invoices, and that is just a lot of regulation that I'm trying to do in, every single day. So I think that simple things like me being a trusted early educator, I know that the shaving cream that I have out is not going to be like swallowed by the preschoolers that are using what we just had. I also think, another example of that is family childcare educators are providing these services in their home, and not all educators have a space that is separate from what they're using with their families. So the very bathroom that the kids are using, their families, their children could have used just moments before. I also was dinged by having my daughter leave the toothpaste right at on the edge of our medicine cabinet. So in the same way, we definitely need rules and regulations, but they need to trust that I have all of the certifications that I could ever have, and I am doing the work that our community needs me to do. So I should be a trusted educator and have some flexibility.
And Jamal, before we turn to Q&A from our incredible audience, I would love to get your thoughts on the same question. And maybe you could bring into it perhaps the idea that there are multiple regulators and conflicting regulations sometime that also make it challenging.
Oh yes, thank you. So that's definitely an issue for us. So I want to just first plus one to both Tiffany and Rhian. I think that's right on point. I think regulations just happen to be too much in the weeds, and there has to be a baseline, right? There has to be a baseline of quality. You can't just do what you want, right? So I think some of the things that need to stay, right? Things like ratios, credentialing, those are no question. Even space requirements, I think that's huge. You know, you can't have 8 kids in a supply closet. That's just not going to work. So there has to be this baseline that's out there. However, I think things that are on the table should be things like facility, right? Thinking about the building as a whole. I mean, Educare is a beautiful, amazing building, and I'm sure there's some great teaching and learning going on in Tiffany's, as well as I know and have visited Rhian's. And when I was a Head Start teacher in a rec center, you know, we did well on class. So the building isn't everything. We know environments mean a lot, but I think sometimes we regulate too much there, and we're not taking into account that good teaching and learning can happen in different places. QRIS, I think, should be on the table and be off. I have my own thoughts about that and that system. But even curriculum, like telling organizations what curriculum they should do. The curriculum needs to have cultural competence and match the children that you're serving. Another thing I think that should be on the table is wages, right? I think Head Start is moving in this direction where they're saying this is a mandate and wages should match the public school. And I think that is not in licensing right now and not in the regulations, but something that we should be thinking about. And to your last point, Susan, just those multiple regulatory, when you have licensing that says, and ratios is one, right? One might say 1 to 4, but Head Start might say 1 to 3, and you have to go with the most restrictive. I think everybody needs to get on the same accord. And the only way to do that is to have the conversations that we're having today and get all of the players at the table to talk about what's best for children.
Awesome. So I think in our reimagined regulatory system, we would have trust in our early childhood educators who were governed by their own professional standards. And we would have, that would allow us to streamline some of the regulatory requirements across multiple regulators that currently exist and really focus in on the things that we do think are important to keeping children healthy and safe. And Marica, definitely feel free to have the last word on this particular topic.
Yeah, and I think part of the conversation is also there needs to be an ecosystem of accountability, right? I think we're all trying to do one thing, right? There's a role for a regulator looking at the safety of the building. That is really important. But that regulator then does not define pedagogy and competence and quality of the practice. That's the profession's responsibility. So part of it is the duplication we're seeing is that everyone wants to be everything. And I'll even say for the profession, your role is not to define building safety standards. Do you know what I'm saying? Like, that's not your lane. So much of the streamlining that needs to happen is actually a recalibration, right? To be like, who's doing what? Who are we holding accountable for making sure Educare DC building is safe? That is not the same entity we're going to hold accountable for making sure that the curriculum is aligned with sort of best practice, other assessment practices are in line with the standards. So part of this is like, it's the who's doing what. And right now it's just, we've commingled all of it where we have the facility folks looking at staff qualifications, the professionals measuring mulch, and most importantly, no one is looking at the individual educator, because in this space, there are no states licensing the individual as a practicing educator. And frankly, that's the biggest gap. And so in the absence of licensing the individual and the challenges that's going to occur by being very rigid about who is an early childhood educator, in the absence of doing that, we're focusing on the shaving cream because licensing the individual is much harder.
I really appreciate that. And before we leave this topic and I turn it to Emily to sort of help us navigate through some questions, I did actually want to turn to Kayla and to you, Marica, just since we've really been talking about regulations in the context of early childhood education system settings, as we've now defined them. I did want to talk about, so what about trusted caregivers? Who regulates trusted caregivers? Who is responsible for ensuring any standards for trusted caregivers? How should that work? And Kayla, do you want to start with that? And then Marica, I know you have some thoughts.
I have a theory. So I appreciate it. You know, I think this is mirroring the questions in the Q&A here. We have seen a history of states who are following a similar model to what our organization is doing, which is creating standards that do not burden trusted caregivers. We know they exist. There has been a history of states, even with the Child Care Development Block Grant, giving grant funding to trusted caregivers if they complete things like basic training, background checks, and maybe even some kind of occasional monitored visit. And as we have seen more families turn to trusted caregivers over the years, given the pandemic and a lack of access to these programs because they're in those 4 at-risk categories, they are turning away from the state. These caregivers turn from the state. They don't see the value in engaging in regulation when the reward is red tape and additional regulation. When that grant did put in, the 2014 grant actually probably brought the trusted caregiver model down a little bit because it did start creating even more requirements. And then there were negative consequences for those trusted caregivers. And so to put simply, the pursuit of this perfect provider, what we know is quality, what we know is educational, what we know is standard. In pursuit of that, we lost the trust of these families who couldn't afford or access that, as well as the caregivers who were offering that. And so they no longer have access to those state-funded resources. Families don't feel like they can turn. Families utilizing this model don't feel like they can turn to the state because they're going to be redirected, right, away from that trusted caregiver model. So, yeah, I think there is a place for regulation, but we really do need to right size that so that we don't end up in a situation where we're doing harm reduction work for families, as opposed to how can we get you these resources?
Thanks, Kayla. And Marica, I know you've done some thinking, and then we'll turn to questions on, you know, who oversees trusted caregivers.
I think this is why it's important to make the distinction. Trusted caregivers are not practicing, ideally, licensed early childhood educators, and therefore there should not be held to the same standards of practice. I think we also sort of in this conversation about trusted caregiver and regulations, we miss the fact that families are also regulators in their own right. That as a family, as a parent, our decisions around sort of a grandparent choosing to care for a young child or a nanny or a parent, the families too have their quality expectations and can regulate in some ways. I think it elevates the role of a family as a regulator as well. I think we sometimes minimize that. And I also think we forget that in giving trusted caregivers regulatory autonomy in some ways, or practice autonomy, we forget that there are state and federal laws that protect the welfare of all children. So there still are laws in place protecting the welfare of children. And so in our model with the trusted caregivers, those are pretty much families who are saying, families and individual and caregivers who are saying, I am not an early childhood educator. Do not hold me accountable to their practice standards. I'm choosing not to align to that. Do not license me. But I want to be recognized as a caregiver. I understand it's not comparable. So therefore, I definitely need some financial support. I need some resources. I'm going to comply with state and federal laws that protect the welfare of children. And of course, use my own sort of standards as well. So that's why it's important to do that separation. Is it an early childhood educator or is it a trusted caregiver? So again, it's our long way of saying trusted caregivers have full autonomy, but of course they must comply with state and federal laws that protect the welfare of children.
And in this shifted model, essentially the parent is their regulator and they're their self-regulator.
Yeah, and again, I will just acknowledge that the isms in some of these conversations, we never flinch, depending on your zip code. If you're a stay-at-home mom or stay-at-home parent or stay-at-home dad in X zip code, it's not seen as something that requires regulation. No one's following you home and saying, tell me more about what's happening in your home with your child, right? So in many ways, the future is happening now where many families use au pairs and nannies and themselves are stay-at-home parents without sort of government saying, I need you to tell me more about what did you feed your child today. Now, certainly, again, there are federal laws and state laws that protect the welfare of children that all need to comply with, and that's in place for the trusted caregiver as well. So trusted caregivers have significant autonomy, in part because they're not practicing as an early childhood educator.
And thank you for bringing the isms into the room because we don't question certain kinds of care, as you say, and certain kinds of zip code that are operating without those kind of regulatory requirements. Well said. Okay, Emily, I'm going to bring you into the conversation to help lead us through some Q&A.
I am so fascinated by this discussion. Thanks to all of you. And there are some really interesting questions. I feel like both Alice and then we have an anonymous attendee asking a question. I don't think you really touched on this, but basically the question is there a way for the educators, the trusted caregivers to be organized, maybe unionized? Like, what is the best sort of like form of you all as the experts communicating with them as a group to get them to take care of themselves and raise up themselves?
Anybody want to take a crack at that one?
Has anybody thought about the possibility of a union or some way that where they are able to negotiate for themselves?
I will offer this, and then I'd love the panelist to jump in. You know, it is not, there are existing unions that include childcare professionals who have, and you know, for example, SEIU, who has done some work unionizing, particularly family childcare providers. So it is not unheard of or untried in certain locations and with certain existing unions. But I'm curious about what other people think generally about the concept.
I think that's a very hard question to answer. And I won't even take a crack at it. But what I will say is I think if we concentrate on the right things, that may not be necessary, right? So if we concentrate on wages and we ensure that early educators are getting top wages, or we use the mechanism in front of us, which is that it's comparable to the public school. And I think if we focus on staff wellness and professional development, like if we keep those things top of mind, meaning that the organization, the culture will be suitable for them, then that won't be a route we have to go to. How do we get all on one accord? Whole different topic for a different webinar.
Thank you for taking a stab at that one,
That's
Jamal.
why, sorry, I'll
Go ahead.
second Jamal as well, which is why I think
Yeah.
it's also important for us to figure out what is the baseline quality standard for this industry, right? And I will argue that baseline quality standard has to be holistic. So while certainly research supports the importance of adult-child interaction, the well-being of the educator also matters. Instead of taking a holistic view of quality early childhood that encompasses working conditions and wages, is also really important. And those elements of quality never gets included in the ways we regulate in childcare. So again, this is why it's important for the professional to define themselves, because you will then find those components in the baseline standards, working conditions and well-being.
This question from Lottie, I think, is a good one to bring in the idea of teen parents into this conversation. Her question is, what will be the impact of these changes on teenage parents and their access to quality care? And, you know, Tiffany, I heard one of the things that really stood out from what you said is that you're doing what your community needs you to do. So I'm wondering if you have a perspective on this, but anybody, please share your thoughts. I think it's an expense question primarily, right? Yeah.
Your sound went out just for me for just a tiny bit. Can you repeat that?
Oh, sure. Just the question of, with the changes that you all are all suggesting, how will this impact teen parents and their ability to access quality care?
So in Montgomery County, I think, in Montgomery County, I just have to applaud our local government in that they have been trying to be innovative in their thinking about how we support community members, especially teen parents, many of whom have infant and toddler care needs, and they have created a new grant that teen parents are automatically qualified for, that covers the true cost of care, and they do not have to have a copay. So just thinking about how we can support teen parents, knowing that they do not have the means to fund the system of care that they so desperately need.
Thank you.
I would just add to that I think that this change actually supports that, because if we think about equitable solutions and we think about the cost of care and who pays for it, if it is funded by local government and it's on some type of sliding scale based on income, then you do support the teen parent. And then also when you think about choice, if the family childcare home happens to be next to the school that they're going to, then they take their child where their need is met. Or like Educare, we built a center base inside of a public charter school, not to support necessary teen parents, but to support the CTE program there. However, teen parents now have a better solution for their children where they're able to drop off and go right to school. So I think that this model does say the choice is there for families, and what they need is what they get.
That's awesome. Okay, so this is a question from Lauren, and I think it's an interesting one. Early childhood education is one of the professions most impacted by COVID and long COVID and increasing illness overall. So what do you all think about ways to protect caregivers and children from repeat infections and the burden? Is there ideas for mitigation such as air purification, vaccination, appropriate respirator use, adequate sick leave? So how is that factoring into all of your discussions about the future of childcare? And how can access to these kinds of mitigations best be promoted and supported?
Emily, I'll start just because I happened to have been in the Department of Health and Human Services when COVID happened, and we were a super agency. So we had all of health and all of human services and childcare under one roof. And I will say, I think we have to do what we advocated for ourselves for during COVID, which is put childcare providers at the top of the list for resources and treatment that are going to support their healthy work environment. But I will say that one of the biggest factors in sort of disease prevention in general is going to be, what is happening in the classroom every day in terms of meeting basic health and safety standards. So you really have to start with that floor and then make sure that childcare providers have ongoing access. And this is something that Childcare Aware of America tries to do, is really to try to get our on the ground member agencies to partner with public health departments to make sure that childcare providers are getting ongoing resources and education materials and support, managing through COVID and any kind of infectious disease.
Thank you for that.
Emily, can I add something? It's a little bit
Yes, please.
It's a little bit of a pivot, but in the broader context of prioritizing the well-being of early childhood educators, we cannot have this conversation without talking about compensation. And we've never been able to really prioritize compensation for early childhood educators. And the unifying framework is decisive that none of the rest of the recommendations in the unifying framework happen without a floor of compensation equivalent to what the science is telling us early childhood educators have to know and be able to do, and et cetera. And so in the context of putting out, reimagining the future, what would happen if I have been, being a new provider in DC, I have been completely in awe with both the policy and the money in the pay equity fund. It is a game changer. Like, if we're not watching closely what's happening with the pay equity fund, we are fools, quite frankly. And I mean that both because of the real money that's involved, the system structure changes, that it goes through the employer, that there's tax on it, that it pays into your Social Security, that the employer has skin in the game. Like, it is, there is no silver bullet in public policy, but it is so good. And everyone wrings their hands and says, oh my God, there's no possible way we could replicate that in different political jurisdictions and states and cities and whatever. But I'm just going to say, like, radical reimagining. What if we said we're going to stop redefining quality everywhere we go? By every program, we're going to use NACCE accreditation, and we're going to use NAFCC family childcare accreditation. And that's what the industry says we want for quality. Is it perfect? Absolutely not. Is it going to provide a floor of quality that matters? Yeah. So let's just say we say shifting the vision is NACE accreditation, NAFCC. We don't spend another dime on quality improvement and rating systems, and we put all of that money into replicating pay equity funds around the country. Like, to me, that is a game changer. And I just go back to what Marica said at the very beginning, which is maybe simplicity will be the thing that like really redefines where we're headed. And I think we've got to allow ourselves to think that radically.
Well, that kind of goes to, I'm going to read to you Alan Gutman's question, because that speaks to that. But he says, going back to the cartoon of who wants to change, perhaps the greatest challenge to change is how to unify a system that was designed by multiple architects, i.e. state and federal government, and then built and operated by multiple providers, schools, nonprofits, for-profits, individuals, and homes. Perhaps the builders and operators have grown comfortable in some of that independence and reluctant to unify in beneficial ways. So any thoughts based on that reflection?
I agree, right? We've inherited an outdated system that's overly fragmented, right? And I'll also add, we do have industries that profit off the fragmentation. So as much as we bemoan the childcare system for being broken, we have industries that are thriving because of their role in the broken system. So there's a tension here between fixing the system, aligning, and sort of who struggles the most with that. And I'll say who struggles the most are the folks who are benefiting from the brokenness of the system. The folks who have the most power in such a broken system are the ones who will be more resistant to sort of this idea of sort of unifying, which is why, again, I often turn to other industries and other professions when I need sort of clarity and sort of gauge whether or not some of these reimagining ideas as driven by data from educators and families are just radical. And I will say, what we consider radical in childcare, others are like, where were you? That was 20 years ago, we did that. So part of it is also sort of putting innovation and reimagining in its place. Like what's radical to us is like, so it's 20, like the nurses are like, we did that 50 years ago. Welcome to the table. And so just sort of put it out there. I mean, like if you just follow, for example, licensing compacts, right? We have many industries, again, I'll go to the nurses, therapists included, where they're like, wait a minute, we can all just agree on licensing nurses or licensing physical therapists in the exact same way. If we all just sit together and agree that these 5 are the essential ingredients for licensing, we can just create a pact. And it means that a nurse from Florida can quickly fly as an emergency to New York City and walk in and land and be able to practice because of that unifying. So like there are definitely benefits to unifying and aligning, but it's gonna be challenging, but it is necessary. And other professions have done that, and we have models in other industries that we can rely on, like the licensing pacts.
Yes.
Yeah, I would add, I love that question, and I love what you said, your response, Marica. And I will just say, I love the phrase, the system is perfectly designed to produce the results that it gets. And we say that, we have a broken and unequitable childcare system, and certainly a huge amount of that is underfunding, racism, the isms, but it is also the system that we have produced and that we are operating in. And so I think this is where we started, which is we have to be willing to change and do things differently. And that will mean sharing and or giving up power in some cases. And those are harder conversations to have, but those are the right conversations to have.
And so Claire has a bunch of questions, and I think we just need a little, a little more clarification around the sort of difference, right? Like, so are you either a publicly funded early childhood educator, or you're a trusted caregiver with minimal public funding and family provided accountability? Like, do we feel like it's an either or how are you preventing it from becoming an either or?
I think it's a both and. Right? And the question again, as increased public funding is coming into the space, as frankly, and as a private funder, what am I paying for? Someone like, right? I need to be very clear, right? Again, using the dental screening example, when I'm contracting or with a dentist, I'm very clear. I'm paying for this service provided by this profession. And so I think the same thing has to be clear, like what are folks paying for? Which is why some of the language in the current system may not work in the reimagining system. Part of the change is a lexicon change, right? Where you, in sort of the simplicity here is like you're paying either for an early childhood educator in the early childhood education program that's going to be held accountable to the professional standards of their field, which certainly includes working conditions and the true cost of quality, or a trusted caregiver that gets some financial support and more autonomy. To wedge in other examples in the middle becomes murky, because I'll argue, so what is a program that's only meeting facility safety standards?
Yep. Well,
do they get government funding?
Yeah.
Significant government funding? Do we give significant government funding to a program that's like, the building is safe and there are bodies in the building and the ratio is right? Maybe there's a funding stream for that.
Yeah.
But more and more the funding streams will be paying for early childhood education in early childhood education programs, and educators are going to be like, I want my compensation. So I think we have to clarify what are we paying for to help to respond to that.
Yeah. Thank you so much. All of you, thank you so much. Oh my goodness. Susan, what an amazing moderator you've been. Marica, thank you so much for setting it all up. Rhian, Tiffany, Jamal, Kayla, your thoughts have been just so incredible. Thank you for answering the questions that came in on the Q&A. Sorry for those of you who don't feel like you got your questions answered. I do feel like we got through a lot of them. So thank you for this great conversation. I also want to mention again, we are in the process of designing a session that's going to focus a little bit more on the, private equity and other profit-driven support for childcare. So that's going to be in February. Keep your eye on your email for that one. We haven't fully organized it yet or scheduled it yet, but it's going to happen. We have a few people confirmed, so we just need to get that on the schedule. And so we just I want to say thank you again. This has been a fascinating conversation. The Campaign for Grade Level Reading really wants to make sure we're providing the platform to have these kinds of conversations, even if we're not the experts. You all are the experts. So thank you so much for sharing this with our audience. And I just want to encourage everybody to come and join us again next week and the week after. If you want to pull up that slide again, we have a couple of the holiday rebroadcasts coming up. And then in early January, we have a couple of very exciting sessions. So join us next week and the week after for the rebroadcast. And then starting January 7th, Beyond the Ballot, Sustaining Progress in Academic Recovery and Early School Success. It's going to be very interesting. And then on the 14th, Equitable Literacy Instruction, ensuring the science of reading works for all children. So thank you everybody so much for your participation today. Thank you to our awesome panel. Have a good evening and a good rest of the week. Thank you.
Thanks, everybody.